right, so starting our second panel, if I could ask up to the stage Dr. Priyanka Mathur and Greg Nassief. All right.
I'm going to sit more under the AC. So.
All right, so this panel, the goal here is technologies as a driver for improved patient experience and health outcomes. So Dr. Priyanka, I'll have you start maybe the same way we did the last panel. Just talk a little bit about yourself and what you do.
Sure. So my name is Dr. Priyanka, and I founded a company called MediPocket, and our vision is to connect world to the U.S. healthcare system with a cross-border care. So we are connecting the international patients looking for critical care, for cosmetic care to United States, starting from remote second opinion, treatment, and clinical trial programs here. Clinical trials program here. A little background about me, why I started this, because I was born in India. I did my medical studies in Russia, went back to India, worked there for a few years, and then came to United States. What I've seen with this small global healthcare system that I've touched is the gap in specialty care when it comes to these, Asian countries mainly, that they do have a desire and need to access the US healthcare quality, but they don't have accessibility, how to do it. And we are trying to solve that with our platform.
Fantastic, thank you.
Thank you. I'm Greg Nassief. I founded SixKind really from a previous experience with another company. We've been doing medical advocacy for well over 10 years, and what I found was a little bit like yourself, doctor, was there was a divide. There was a need for a greater access to data and intuition about healthcare because people are so mobile today. The system's gotten so opaque today. Who's out there advocating for the individual today? And there's very few people, and it's extremely difficult. So we've actually been putting together a system that builds on data, builds on a little bit of AI, which is a little bit of a cliche to say, but there is a lot of advancement in how we learn and get information today where you can anticipate more. So we actually have clients that are individuals, families, companies, some very high-profile people, and then some people that I would call professional adventurers. You just never know where they're going to be. And so we've literally done cases on every continent except the South Pole. And I have hopes for that this year because I see people are going to the South Pole, so we'll probably be flying somebody out of there. God knows. But we've seen and identified a real growth. I'm fascinated by your model because it's very similar. It's really trying to take the world and connect it to the resources that are there. So SixKind's whole mission is to get that to a point where it not only is it complementary for the individual, but for the care provider, because that's the other issue. It's very hard on doctors to deal with patients, especially if they're coming from somewhere else, or after COVID, there's a lot of maladies around that have come up that people are not really talking about. Not everything gets in the news, and there's a need to connect. So that's really where we've been putting our time.
Let's go a couple layers deeper into your company. So SixKind, maybe go a little bit further and tell me more about how you plan to continue on this mission.
Well, so the major thing there is kind of what I said at the beginning. So we've been trying to build out the data part of this, because the more information you have, the more you can triangulate and solve the problem. We're actually working with Dr. Marty Trevino, who's here today, and I think he's singing, so don't believe he's got a great voice. He's got a great voice. But we're putting together the AI components so that we have a more efficient, more well-rounded processes. And kind of quoting Marty, one of the things that he said that fascinated me is the ability to make an information path decision. So when you get into cognitive science, I'm just going to say it that way, Marty, it's like literally putting three thought bubbles up that are all three information packed that a normal person who normally isn't trained to digest can digest and make an informed opinion. Nobody was talking like that on the street even 2 years ago, and now we realize how important it is that we have enough information even for basic care. So AI is a big part of it. The global, we've been working for years building our own network, so just, continuing to make that more robust and to be able to even improve the care people can get when they're overseas. Sometimes it's something as small as just having, I don't have an Apple Watch on, but people that have their watches on and they have all their, all their devices can now be monitored. If you're far enough away, people like to go to southern Italy, forget adventure travel. People love to go to, Stromboli, because it's beautiful, and what happens when you're down there, there's no medical system. So at least now there's an ability to actually manage something for you, get somebody on it that can get you some pathway to what you need, and then get you to the care that you need, either in Italy or back where you're from.
And so how does this, I know a lot of people that are either in the audience or that'll watch this online, maybe they're a private practice and they hear what you're saying, like, okay, but my patients aren't there, I'm not looking at that maybe particular market. How does this boil down to the practice?
So I would say actually it does apply to you, because the reality is your patients, especially here in Los Angeles, this isn't a city, it's a country. I mean, the diversity of people that are here, there's a reason LAX is busy every day, because people are coming and going. But there's a wide range of people. Many of them are your patients. And so what happens is you need to be the thought leader for that individual, for their family, for their company, depending on what kind of a patient you have. You've got to be able to talk to them and inform them in a way beyond just when they come to the office and you read the chart and you make a prognosis. There may be something more there that they want from you. Because what we're seeing today is people want more determination in their care. It's more personalized today. So what's best for me? So if I had diabetes, I want to know all about diabetes, but I also want to know about my family history, and I want to know about how does this apply to me and my family, along with what I'm getting from basic care. So it's very important to stay relevant across the board. So you need augmented services that actually help you to communicate with your clients, because doctors are very busy. These offices are overrun these days, but you still need something that helps with the patient and gets them more care. That's the 30,000-foot view of that.
So maybe talk to me about maybe tools or resources that either that you're seeing or that can be used. And Dr. Priyanka, if you want to jump in after on this one too, I think that we want cheers on that too. But tools or resources.
So two ways I'd go with that. Number one, again, we talk about AI a lot. AI is only as good as the human delivery system that brings it to them. So anywhere where you can leverage a platform that's going to get you a lot of information that's complementary to your patient, to your population, and a resource that, like a really good trained call center, that can interact with your patient, that can help and then have some kind of a network if you have to hand it off for whatever reason. Could have something to do with the specialty requirement, could be a geographic requirement, but all that needs a really good human delivery platform. So it's either the people in your office, or it's a call center, or it's a doctor group, or some kind of a med tech group that can actually interact and take that information, disseminate it, simplify it, and help the individual. If they're doing that for your practice, then that's a good reflection on you, because it shows that you took the time to actually think about them beyond just why they call you to come see you. I've been talking long enough.
Those are all relevant, very relevant. I would just take it a little back to the past, like the tools which we have currently to appreciate how they actually made an impact. So, back then, in order to request the records, these were the physical files that were requested from various doctor offices and hospitals, collected and then sent to that particular specialist in order to make any diagnosis or conclusion if it's a medical legal claim or anything like that. So it took a lot of time when we were doing physically. Then came internet, and with internet, it's this EHR system were built. So that really helped in processing the things much faster. And now the access of such information were through this internet made faster, where they can be collected in a shorter period of time. But there was no intelligence to that. I think what AI is doing is applying intelligence. It's not just bringing those data or information to you, but it also is applying intelligence and putting in the right segments. Okay, this is what you need to know, because again, they don't have a physical limitation. These AI models or ML models are robustly can analyze a large amount of data. And which sometimes as a human, we have a limitation, we can miss and all that, but these are machines, so they don't miss it. So I think the intelligence applied to the internet is what actually AI is, and what you rightly said, AI is as good as what you are providing, the commands providing. Now there's a future which is beyond AI, which would be something different, where I think human assistance would be very minimally needed, but importantly needed.
So we talk a lot about technology, we talk a lot about AI, we have a lot of these buzzwords that go around, and they're all relevant, but the ultimate thing that we're really trying to do here is improve patient outcomes, right? So maybe for just kind of providing maybe an example or something like that, like for the audience and also for our viewers at home, like to really boil it down, what's an example of how all of this translates into maybe better patient outcomes?
Sure. I would say one important thing that happened is patients are now more involved in their own care journey. Before it was like, okay, I looked at your record, this is what it is, and the doctor's giving their opinion, you take it, you go home and you follow, and all that. But I think with AI, the patient outcome or any technology that we're using has really helped, because two things: telehealth, digital health, our remote patient monitoring. These all are keeping the doctor and patient connected. And with that connection, it definitely improves the patient outcome, because you can now more in a real time know what is going with your patient. And now the doctor doesn't have to sit in front and monitor those. That is done by the machines, to alert doctor and a patient if they see any red flag. So definitely it has improved the patient outcome for chronic care. At the same time, it has also improved for critical care, because it helps in early detection, timely intervention, which is very crucial when it comes to the critical care, that timely intervention can be done. So I think these very on a primary level, but very important when it comes to the doctor-patient and the outcome that can be achieved, which is the patient, care outcome.
Is there, and this is if you want to jump in on this one too, Greg, is there another side to this conversation of as we rapidly, as this technology advances, as we start bringing this into our healthcare system, whether it's the sustainability or the responsibility or potential threats even, I don't know, is there another side to that conversation?
Greg, you want to take it?
Sure. Actually, yes, and I think where it is, sorry about that, is security. Digital is exciting, AI is exciting, but the fact is it's an open highway, and you can go on anywhere and you can look anything up, and you can find anything out about anybody you want. So as we roll out these AI models, and what you're doing and what I'm doing, it's important that we create, so when they are getting diagnosed and looking at immense information through all these different studies, you really don't want anybody to know that it's you that they're looking at, right? So why are we looking at this for Greg? They can't have that. So it needs to go into a secure box. It needs to have some guardrails on it that says, look, this is free for me to use. This is for my benefit. It's for the benefit of those that I say should look at this and should be a part of this. Everybody else, all you can see is the data points that somebody was interested. We'll just use the diabetes example again, but they should know that it was Greg Nassief on this date and this doctor was looking. That security is a massive piece of this. And that actually plays into better quality care, because the other thing that takes away is the ability to manipulate the data. And there's a lot of that in the world today, as we know. So, that's my big takeaway from the additional. Beyond that, the evolutions are coming so fast. I don't know that I see the person being removed just yet. I think we're 20 years away from that. We won't care about
Hopefully.
that. But I can see where there's still that need for. I think the workload will go much bigger into the AI model, and then the doctor will probably be a lot more of a person that's still trained the way they're trained now, but that ability to absorb that information and apply, I think that will continue to change, because the technology on how we care for people is also about to have a renaissance we haven't seen in our lifetime. So there's some exciting things coming down the pike, none of which we're involved in, so we won't tout those, but yeah.
And did you want to add something to that?
I think that he touched the very important, which is the privacy part. The open internet definitely does have a threat on the data privacy. Also, I would add, any innovation I think comes with a responsibility. The innovations are done for good. Let's talk about fire. The innovation was done for good. It definitely revolutionized the early human existence with the warmth, the cooking, and other advantage. But when used uncontrolled or weaponized, that is where it also caused destruction of the same habitat. So I think exactly that applies with the AI, which is really fast evolving, and we are not at the pace of regulating it, at least in healthcare. You know, we are not at the par and pace of understanding, and we are just, with the race trying to integrate it too early, too fast, and that does, raises the red flag, which if fallen into wrong hands or not used properly, can definitely have a devastating outcome on the patient, the whole healthcare system, and like that.
All right, so I have one more question for the panelists, and then we'll open it up for everybody else to ask questions as well. So, and this is for whoever would like to take it, or both. So I know that things are moving fast in technology, and I interview people. I mean, this is what we do. We at Mission Matters, we bring new content, new information to the public, and keeping up with the education piece of technology and what's going on in healthcare. I mean, is it I'm not putting you on the hook on this, but regulators, healthcare providers, healthcare community, like how do we bring the public up to speed? How do I stay up to speed? Forget the public.
Maybe I can start if that's
Yeah,
okay.
you take it out if you can answer it.
So I would say this is the time, because as I think the advancements are happening too fast, very fast. This is a time where every healthcare stakeholders have to collaborate now. Starting from the healthcare providers, we need to actually, ongoing basis, need education and training when it comes to technology. We are not trained for that. We never thought that we'd have to even use it to the level that now we have to. So ongoing education and training for healthcare providers. Policymakers have a struggle too, because again, they don't understand this evolving AI, what type of regulations is actually need to be put to restrictions, regulations, because those are going to be very important, because when the AI error happens, who should be accountable? Now all this policy making is needed. Researchers have their own set of struggle, because again, with this rapid AI transformation happening, application to the right application of these for the patient benefit and efficacy is another struggle. So I would say this is a time where it's not like, okay, only it's a healthcare problem or it's your problem, but we have to make a collaborative effort here in order to be par with this very fast-pacing technology advancement. And it can only be when, the technologists help healthcare people, and at the same time, healthcare people have to be with them to make them understand the patient side and the doctor side to bring an efficient solution.
So I would agree, but I also think that there's a layer above this that is really where that regulation is going to come in. Because you're talking about the universal application of AI, not just healthcare application of AI. Because you can go in finance, government, there's so many different regions in that are higher impact, actually, believe it or not, than healthcare. But healthcare, of course, is the most personal, which makes it the most important. So I think what you're looking at there is you're going to see people that are new in AI now that came from data backgrounds, that come out of the technology backgrounds, that are actually available to work for the government now, that weren't before, that are going to be able to come in and say, we want to keep this where it's going to grow, but we need to put a guardrail up. We've learned from social media where the defects were, maybe we shouldn't put the live wire in the water and hold it at the same time. So there was that whole thing. So you can see that there's a regulatory discussion going on right now that is going to go right down the list, and so that what you hope is they don't overcorrect it. But I would expect very much that you're going to see some guardrail over the next 2 years. You have an election coming up next year. I live in Washington, D.C. when I'm not here, and I can tell you that is all the talk, and it's not just who the candidates are going to be. It's got a lot to do with the authenticity of the sort of material that's going out. That is literally that's the third rail, shall we say. So when they figure that out, we'll all know, and then that'll inform, as the doctor says, that'll inform what we need to do in our sectors, how we're going to handle that. So.
All right. Let's open this up to the audience. We have some questions in the audience.
Specific to your two businesses, startups in general, but particularly to have an international scope to them. You can't be everywhere all at once when you start with partnerships. are foreign government partners a key part of your company rollout? Where you're doing something in the Philippines, or you're doing something in India, or you're doing something somewhere else to just get the model the way you want it. But I'm talking about central government playing a role in your companies. Does that apply in either of your situations?
I'll answer first. In my case, no, because what we do is really for an individual, and if we're addressing a healthcare system in another country, we're addressing it on behalf of an individual looking for care. So we're not coming in and influencing the system writ large. We're just trying to identify the right and best resource for someone, at least to get them stable so we can get them where they have to go, or get them care where they are. But we have not had any issue with that. And we've operated in China and Russia a little bit, and which are very different landscapes than anywhere else almost, and we've never had an issue for that personally.
So in our case, not directly, but indirectly, we need to know, because we work with the patient care directly, like with, let's say in the case of second opinion, remote second opinion that we do, we need to get the local doctors involved with that local care doctor with the specialists here. So we do need to work with the that country's regulations, the healthcare regulations when it comes to the data sharing and all that. So indirectly, yes, we need to do that. What I think after COVID, most of the governments around the world have been quite open regarding this digital health and telehealth. The norms have been quite well defined, which before were quite in the gray area, but they are quite well defined. So for us, when we are doing more digital health, it has been so far acceptable. But yeah, we have to sometimes work with the government and make a few here and there adjustments, which is work for them, and at the same time have to work according to U.S. healthcare system.
So a question I had is, I know that the healthcare experience for the patient, for example, from the data flow, is pretty disjointed, particularly from the EHR side, like Epics and Cerners and Allscripts of the world. Are you guys seeing any trends in the market today that kind of focus on unifying this overall experience for the patient that I think ultimately will surface up this data for not only the patient but also for their providers?
Well, actually, that's something we're trying to do through our service, is to actually, for the patient, get everything into one secure area where it can be shared throughout the system and easily digested and read, even if it's in another country. I haven't seen anything personally that's effectively out there that's wrapping everything up into one delivery system, but I think it's more efficient from the individual standpoint to have something that can be read across several different platforms that's still consistent to what their condition is. So that's something that we're actually constructing now. But I mean, I don't see anything out there systematically where someone's taking up the whole system and just consolidating into one at this point. It'll probably happen, but not yet, from what I've seen.
And if I'm understanding, you're talking more about centralizing this health information instead of having separate EHR, is that?
Yeah, because for example, if I'm on an Epic EHR and then my next provider uses an Allscripts or a Cerner, ultimately my provider from the Epic won't have my data unless I pretty much print out my records, bring it to my doctor, have the doctor review it. So I'm more so curious, are there any trends right now for kind of these bigger EHRs to really come together and make it that much easier for the patient to essentially share their information across the board?
Right. So I think the centralized unified, it is not there yet. It would be really helpful for provider side. Now I feel like for the patient side, it's too much information for them to digest. You know, the EHR is very elaborated, which for a patient is not, you don't need to know each and every medication that is administered during your hospital stay. You won't understand, overwhelming. But from a provider side, that is a crucial information, having that centralized system. But I think there's definitely a need and demand, but I think there are a lot of corporate side of hurdles in that comes where they don't want to share, maybe because of the liability issues and all that, where it has not been yet done, but definitely that's the area that is needed both from the provider and the patient side.
I've also got a quick question. So, from my understanding, there's certain, I don't know if it's laws or mandates being passed down from the CDC to control the data distribution of, let's say, the vaccines and stuff like that. Have you seen any of that, or have you what are your thoughts on that? Do you see that playing a role with the dissemination of medical information in the future, being that this is something that's already kind of coming down with that particular segment?
Well, I'll do the best I can on that. So if it's in your personal record, that's going to be viewed by a provider. As far as if I understand it right, I think what you're talking about is the more general findings from when they did all the vaccines and what the data shows. I think that they don't want that. I don't think they want that out to be manipulated and studied in the wrong way. Mm-hmm. But if you yourself have had your 3 vaccines or however many vaccines you've had, I think that could still be viewed by another provider when they see you, because they're going to need to know. Because if you're on heart medicine, they need to know if you've had a flu shot or there's all that. So, but yeah, I think what you're talking about. Yes, I think to my knowledge, I think that they don't want to share. Mm-hmm. I think that's right. Would have no effect though on an individual provider.
Great panel. Thank you guys. I would assume that the preponderance of medical tourism and cross-border healthcare is focused on the private pay, high net worth individual space. I guess, is there a roadmap for creating more opportunities to democratize access to better healthcare for underfunded patients internationally, and is AI part of that solution?
I can take this question because we work in the markets, Asia market, where the affordability is definitely a question when they definitely need and desire the quality here, but then affordability comes as a restriction. And in that case, I think when you're saying the medical tourism is only for this cash paying patient, the solutions like remote second opinion or a remote consultation is definitely a way where they can still get access to the specialist in the countries like United States, but they are not paying for the treatment in hundreds and thousands of dollars in US. So what we have found in working in India, past couple of years here now, that second opinion really helps the patients that are not very affluent when it comes to the finance part. But it gives the benefit of them having a super specialist, getting the treatment or a diagnosis confirmed, treatment design, work with the local care team in India and or any other country, and then get applied. So the efficacy, the outcome is much better. But yeah, this is a little solution. Now AI does play a role because it plays a role where you can, the medical information collection. Now, in the countries like Asia, they don't have an EHR system. They have medical documents which are all scattered and fragmented. So, generally you have to physically collect them, standardize them, translate them, and there's a lot of work before they are submitted to that particular hospital or a doctor. That can be automated by trained models. So AI definitely help in that particular area.
I'll just add, because you use a key word, which is democratization. I think as the information evolves, as it gets refined, I think for a lot of people, because you're right, it's so complex right now to get your information, if you're not in the US system or Western Europe, to effectively get it uploaded. But I think what's going to happen is the information as it evolves will get easier for a layman to understand. So if you're talking about, hey, I have a condition and I'm in Thailand, and what do I do? And you can't afford to even go to the the hospital, the medical hospital, but it goes to have the surgeries they're not allowed to have here. There's still going to be some pathway for you to actually treat that, because as you're saying, doctor, the information that you're going to be able to get and understand is going to make a big difference in how you can take care of yourself. I don't know if that answers your question, but I think that level of exposure is something that just doesn't exist right now in 95% of the world, and I think we're heading. That's the one good part of this. It's going to plain English or plain local language, make it understandable, and you'd be able to do something with that. Right now, you couldn't do that here without a medical person. So I don't know if that answers your question.
Any other?
All right, let's give this panel a round of applause.
All right, everyone. Okay, so we're gonna take a 10, 15